It's been quite a week on the premier current affairs show on radio, Deep Dive on Capitalk 100.4 FM with Rumbi Zaivenge.
But the one thing that we cannot stop doing is conceptualizing, is thinking, is growing, and even sitting down and doing nothing is something. Somebody said that to me once.
The Deep Dive with Rumbi Zaivenge, Monday to Thursday, 6 to 9 p.m. The premier current affairs show on radio.
27 minutes before we get to 7 o'clock, right on Capitalk 100.4 FM, Harris Heartbeat. It is a Wednesday evening, and of course, the show is the Deep Dive. But of course, we get into the Capitalk Forum, and today we're focusing on a critical health issue. Now, the Minister of Health and Childcare announced this past Sunday that Zimbabwe has now recorded has recorded 2 confirmed Mpox cases as well. But of course, gladly, there was a reassurance that everything is under control as well, because there's really no need to panic. And I guess due diligence being practiced, we will find a way through this as well. Now, to just give context maybe to those that are not in the know, Mpox, formerly known as monkeypox, is a viral disease and has been spreading globally. For those that have been following the news, you've been hearing, what has been happening across the globe in terms of discussions on symptoms, in discussions on prevention, and also, as well, unfortunately, some of the fatalities that have happened due to this as well. So we want to get deeper with this conversation. Be reminded that you can be gladly part of it on our WhatsApp 0719 100 404 and tap into this evening's Capitalk Forum discussion. Joining me for this conversation, the Principal Health Promotions Officer for Harare City Health Department, Mr. Israel Makwara. Makwara, thank you so much for joining us this evening on Capitalk.
You're welcome, Kuzi. Thanks for having me.
Awesome. So I can't lie. I'm one of the people who were taken aback when this announcement was made that there were 2 recorded cases of Mpox. I mean, we had been hearing it over the news, obviously, what had been happening regionally, but to now embrace the fact that it is now closer to us came as a bit of a shock as well. But however, I understand it was explained, obviously these 2 had traveled before, I understand, to South Africa and Tanzania, and hence we recorded these cases. But just to give context, how severe is this Mpox disease that we're facing?
Thanks, Kuzi. What has happened is, with this disease, I think for the first time, this is where we have had cases being reported in regions or countries, in many countries at the same time, including areas where the virus has not been isolated. But with this disease coming, amongst our populations, in terms of severity, it's subjective. Unfortunately, it depends on who got the disease. Do they have other conditions? What other factors are at play underlying acquisition of that disease? But if it's anything to go by, from an epidemiological point of view, the case fatality for Mpox actually is lower. We are looking at, in terms of countries like ours, where our health delivery reaches all the corners, and our sub-national systems or public health emergency teams are readily alert, you'd find we are looking at far less than 10% case fatality. But in an ideal situation, we don't want to go beyond 2%.
Yeah.
But in other countries where you find there are displacements, there is war, that's when you can have a lot of people succumbing. But with this disease, mind you, it's also a self-limiting disease. That if you are a healthy person who do not have other underlying conditions, if the disease goes untreated, at some point in time, within a space of 3 to 4 weeks, the disease will end on its own.
Right.
But in that period when you're highly infectious, when you have signs and symptoms that are now clearly visible, you'll be highly infectious and you can spread the disease. No wonder healthcare workers are imploring every person, should you suspect after traveling, visit your nearest health facility, get assessed by the qualified health professionals, and if there's any care that you should be instituted to your being, it will start happening.
Now, speaking of signs and symptoms, ndezvipi zvimwe zvatingaona nazvo to just identify, kuti this might be perhaps leading that way?
Oh yes, thank you. We'll talk about signs and symptoms asi toda kubva tagara taonesana so that vanhu havazotya. MuZimbabwe Mpox haisi endemic, saka macases aya akataurwa nahonorable minister wedu ma-imported cases, and amongst history inenge iripo pane history of travel to other countries that are suffering the same predicament yatinayo. They are also having positive cases. Saka kana pasina history of travel muZimbabwe tisiri endemic, it can mean other things, and mind you inoshowa zvimwe zvinhu zvakafanana nana chickenpox, especially mavesicles ayaya. Saka ndo zvimwe zvezvinhu zvatinoda kubva tajekeserana nevanhu, nekuda kwekuti munhu patichamudza kuti zviratidzo irash, mumwe munhu anogona kunge aine karash kwakupisa obva auya achimhanya kuti gentleman, I think ndiri kuonawo zvinenge zvatanga. Saka ndo patinoda kubva tangodhispela that myth, but zviratidzo sekutaura kwawaita, isusu kana tichitarisa a suspected case, munhu anouya todova nefungidziro yekuti anogona kunge akaexposwa kuMpox, munhu anenge aine acute rash iye yangotanga kubuda out of nowhere, haana chaari kureacta kwachiri, and also vamwe vanoita ma-acute skin lesions, atinoti ma-vesicles, or anenge mukaona munhu ane chickenpox, kaduzo kaikai kaanoita kana kaine fluid ndo zvinenge zviri common, and kuwanda kwawo matuzi iwayo, it shows the severity of the disease, and it can be accompanied by one of the following: kutemwa nemusoro, unexplained, acute fever, and we are looking at 38.5 degrees or above, mwanda abva swollen lymph nodes, tinoti lymphadenopathy, kwehealthcare, then pain in muscles or a group of muscles, hauna exercise, hauna kana umbotamba kumabhuza but uri kunzwa nyama dziri kurwadza, back pain, general body weakness, kungorukutika kuye, or any other unexplained papular or vesicular rash. Munhu iyeye tinenge tiri highly suspicious, and investigations have to be instituted as soon as they interface with the health care workers in their area or region.
Interesting. Now, before we talk about the matano angatorwa, maybe to contain, or maybe it actually falls in that same line as well, because I understand then kuti zvazikanwa kuti ndo zviripo, obviously those that were in contact nevaviri as well vakambva vatorwa sema-subjects as well. So ndapi mamwe matano ari kutorwa as well, and maybe just even applauding as well the efforts also to then trace the those that were in contact with these two, and ideally then isolating them. Ndapi mamwe matano atingatasana nawo in terms of preventing transmission?
For now, when we pick a suspect or a probable case, or a confirmed case, pane a lot of statutes ziri at play to make sure that that very person, especially in our case we have these two people who have history of travel, isusu tinenge tichiti ndo ma-primary cases edu as a country. Saka isusu hatisi kuda tinoti ma-secondary cases, vanhu vakuzotapurirwa kubva kune ivava vatawana. Saka chekutanga chakaitwa nevashandi veutano ndechekuti vanhu ava vazikanwa, vakateerwa kwavanogara, then vapatorwa ma-samples akaenda kuma-laboratories, ndo akazoconfirma kuti zveshuwa iMpox. Then izvozvo zvapera, kune vashandi, some health professionals in our midst who institute contact tracing, vauda kuteera pese pakatsikwa nemunhu uyu during incubation, even after confirmation. Saka the highest people at risk in this sense, we are looking at healthcare workers who attended to such people, their household family members, in the event of married couples, their sexual partners. Saka ndo vamwe vanhu vanga vachiteerwa ivavo to make sure kuti we try and nip transmission in the bud so that we do not have an upsurge of cases. Saka, as far as we are concerned, that is what has been done. But outside that now, a lot of things that had happened before we had my positive cases. Right. You would find the ministry and Isusu as Harare. Harare were part of the provincial teams, Ziriko. Saka, this has happened in greater Zimbabwe. But I'll speak for Harare. But what I'm saying has been happening all over. Right now, you'd find my preparedness and response plans were made and are in place. Saka vanhu vaitotreka zviri kuitika kune dzimwe nyika, including ku hotspot that is in the DRC. Then paka-activatwa national and sub-national incident management systems. These are platforms where healthcare workers now are grouped by specialties so that they do what they need to do to contain the spread of the Mpox. Then healthcare workers were trained before we had confirmations. They are still undergoing training and they'll continue to be trained because, mind you, this condition in a way is kind of novel, especially to us muzima hatina umbobvera tasangana nayo chinhu chinyowani zvatakambosangana nazvo paCovid zvezvi. Saka every day as we track it, follow up, should we have an upsurge of cases, pane zvitsva zvatinenge tichidzidza. Saka tinenge tichidzidzisana isusu vebazi reutano and all other stakeholders, that is government ministries, other stakeholders and the community at large, on what we can individually and collectively do to make sure that this disease does not spread far and wide and we do not have fatalities.
Absolutely.
Yeah.
Now, speaking on the idea that this could have been found through travel, I'm curious to understand kuti apana here collaborations maybe are kuitwawo nemamwe mapazi. I mean, obviously vana UNICEF vanenge vari heavily involved in it, but nedzimwe nyika in terms of then what's happening in terms of guidelines of travel and how it can be minimized when we talk about international boundaries.
Fantastic. If it's anything to go by, this condition has been described by Africa Centers for Disease Control is really a public health emergency of continental security, which means that we have more African countries that are affected. So what has happened is after Africa CDC declared that WHO, which is our World Health Organization, and it's a technical partner of it. In fact, I could use that's part of international governance in terms of healthcare work. They declared it a public health emergency of international concern under our international health regulations. So countries now are working together to see how they can contain it, such that when we have visitors from affected areas, what is it that we need to do to make sure they are well taken care of, and as they migrate into our zones, how can we make sure that they do not spread should they have it? And even our countrymen, when they visit such places, be it for business or pleasure, what information are we going to give them so that they are proactive in protecting themselves and making sure they do not unnecessarily expose themselves when they visit those regions? So right now what has been happening is there's a lot of screening that's going on per my ports of entry. And my ports of entry zedu Muzim, Tinana, Chirundu, Bait Bridge, Tine, I think wakwenda ku Mozambique, all those. And we also have our international airports. We have public health workers screening clients who are coming from outside, and at the same time they are educating those who are about to leave to go to such places on what precautionary measures and public health measures they need to undertake to make sure that they are protected and remain vigilant in the face of adversity.
Interesting. allow me to maybe just pass through Nyazi treatment when we speak about iyo Mpox kuti ndezvipi zvinotariswa in terms of treatment, and what are the options anenge are available?
First and most importantly, Mpox is a viral disease. So with the viruses, it's quite interesting. Hatina that magic drug yekuti tikakupa tota ayo my guy, you are done. So what we do is management yatinopa muzvipatara sevashandi veutano, it depends on disease severity. We'll try and institute infection prevention and control more facility, because healthcare workers are at the highest risk. Saka we need to protect them. Saka ndopo unona tichishandisa ma space suits aye PPE atishandisa pa COVID we need to protect them. Then since it's viral, pane symptomatic treatment. Unayo hapana pangu parikurwadza, we monitor you, we observe. Ukati musoro watema, we manage the headache disappears. Tikaona wane karonda kuita onge kuda kuve infected, we manage that, and that is optimized supportive care. And in that optimized supportive care, we'll be looking at your physical, psychological, social, support to you, the patient, and to your family members. Because then management of skin lesions and wound care. Then if complications do occur, they are managed by specialists. And last but not least, since this is a virus, we also do antiviral therapy.
Yeah. Interesting. Really, really reminds me of COVID in so many ways as well. Now, education obviously is key. What are some of maybe the things that are being implemented to educate the general public? I mean, obviously, we are also in that same line of business to make sure that people are educated, like we're having this conversation. Aspane mango matano kutoro in terms of kutsitsa vanhu nezve Mpox as well. We could, how can we generally just stay away?
Yeah, a lot is happening, and the first and most importantly is some activities. I think me being here, thanks to you, that's part of the efforts to make sure that our communities get as much awareness as possible. I think from credible sources, and mind you, we also have our counter measure, which happens to be social media, where people are in the habit of sensationalizing. I think wrong information meant to bring harm, pandemonium, and in a way panic. So what has since happened is to inform the communities. Community health workers in and around the country have been trained to go door to door, visiting residents and communities, educating them of the impending danger that is hovering up over our country. At the same time, you would find the ministry, through our superiors, they are now conducting scheduled radio announcements where they update the country on what's happening and the plans or what to follow in the event of any changes with regards to what's happening. And if it's anything to go by, our minister issued a statement which amounts to a declaration, which means they indicated, and that was as transparent as it comes, to tell the nation that this is what we have. Do not panic. It's under control, and we are doing a number of things to make sure we control and contain it. And here in Harare, you would find we are now going to be visiting our transport hubs where cross-border vehicles, dock when they come in. We are thinking about our road port, High Glen, Mbudzi, Kuinterchange, where Pamachipisa, where those bus drivers, and we are also trying to follow the transit routes of our truck drivers who come through our country. And in this, plans are underway to rope in our therapy, women, our roadblocks. They will also be exposed. We have the traffic Safety Council of Zimbabwe, which we want to also rope in to assist in educating. They are brilliant at it. They always teach us, especially towards festive seasons. Zinara, of course, then other government ministries, departments, agencies, everyone is to undergo, I think, orientation, sensitization, so that the constituents they interface with is fully aware of the developments that are happening in the health sector with regards to the Mpox virus.
Lovely stuff. I think it's really refreshing to hear that there are those drastic measures that can be implemented to make sure that we stay vigilant and we stay aware, of how to react should we then come across such. In conclusion, Makwara, I understand the main route of Mpox virus transmission is direct contact.
Sure.
You cannot took it skin to skin. In fact, the other day, someone jokingly said, I can't greet you. Let's go back to the fist bump, which I thought was really good as well. For us to then start practicing or going back to those practices, because I think tineka kurelaxa katakaita as COVID was weaning off as well. So generally for the general public, and the ships are tingaitao. To just make sure that we stay in the right lane and make sure that we don't encounter it.
Like you rightly put, I think when we are in an outbreak mode, I think it takes its toll on us physically and mentally, actually. Because if it's anything to go by, around COVID time, everyone, what they simply wanted was to take off the mask. But now, also, we need to really relook at our public health measures to contain any disease. And if it's anything to go by, you'd find most of these conditions, they are transmitted more or less the same. So what would highly recommend is to ensure that we continue practicing good hygiene. And travelers, should they come, they need to isolate whilst we are getting in touch with the healthcare workers and contact tracers who will come, assess and advise. At the same time, you'd find the contact now, we have to qualify it depending on the area. There are issues to do with sexual contact. There are issues to do with people who are immune suppressed, who are at high risk of acquiring this, and even prolonged face-to-face close contact. It can lead to droplet infection. No wonder right now I'm noticing a number of people are wearing masks, which is a plus on our part. It means they still remember how important those were in making sure that we protect each other from such.
Absolutely. I think COVID was really a wake-up call in terms of a turnaround, in terms of how we conduct ourselves. And like you say, just staying hygienic. And some of our practices, we've had to rethink that as well. Mama Kwara, thank you so much for your time. And thank you so much for such an insightful conversation. Hoping we'll have more of these as well, just to make sure that, we are aware and we're conscious about what is happening around us. Thank you so much for your time.
Yeah, most welcome, Kodze. Thank you. And thank you, Zimbabwe and Harare, to be specific, in all your four corners.
Absolutely.
Good evening.
All right, and that pretty much brings us to an end to the conversation on the Capitalk Forum. The Principal Health Promotions Officer, Harare City Health Department, Mr. Israel Makwara, in studio, and the conversation was based on Mpox awareness as well. Keep your ears on the ground, It helps just to read around on social media. I believe the ministry is always posting, always keeping us updated, and it does you more good than harm to just go out on the internet and really just find out for yourself. Mpox, how does it spread, and how can I protect myself? That conversation, of course, wraps it up for this hour.
It's been quite a week on the premier current affairs show on radio, Deep Dive on Capitalk 100.4 FM with Rumbi Zaivenge.
But the one thing that we cannot stop doing is conceptualizing, is thinking, is growing, and even sitting down and doing nothing is something. Somebody said that to me once.
The Deep Dive with Rumbi Zaivenge, Monday to Thursday, 6 to 9 p.m. The premier current affairs show on radio.